tired.
You're tired? Why? Why is that?
I think I need to sleep. We're here for her 1 week appointment.
Okay. Yeah, we'll go ahead and get you checked in, and I'll show you to your room.
Thank you.
Jillian. Hey, ma'am. How are you?
Not my best.
Tired?
I'm exhausted.
Does she do this all the time?
Oh my God, nonstop.
Can you tell me her name, date of birth, real quick?
This is Lindsay Cheek, and she was born on April 23rd, 2021. We're supposed to be here for her 1 week appointment, but I feel like we need a lot more than just a, evaluation.
Yeah, okay, so she's been crying like this.
Like this.
For a week.
Non-stop.
Non-stop for a week. How's she feeding? She's
She
taking it
don't.
well?
No, I give her her bottle because I don't breastfeed. I just don't do that. And I give her her bottle, and I'm telling you, it's like she just rejects it immediately. I mean, it like comes out of her mouth at me.
Yeah. Was she like spitting it up, or just like bleh, like falling out?
It's like it kind of falls out.
Okay. Well, look at her little mouth. If she cried a little bit harder. All right. Well, food is coming out of her mouth, and formula is coming out of her mouth. She got cleft palate.
A cleft palate?
Yeah. So you have this hard part on the roof of your mouth, and it's got a split in it.
Is it something I did?
You didn't do anything.
Okay.
No, she was just born with it. Sometimes it can be.
Hello everybody, I'm Dr. Towney and I have this baby here today. We are thinking that this may be a possible Cri-du-Chat case, so we have got to go check it out. Come on. Jillian. Hello Mom and baby, how are y'all doing today?
We're tired.
Yeah, okay. So tell me how long this been going on.
Since she was born.
Okay, and when was she born? What's her date
A
of
week
birth?
ago. April 23rd, 2021.
Okay Mom, I'm going to take a look at baby, okay?
Okay.
I just have this
Do you want her? 'Cause
tape.
at this point, you can have her.
You know, they do better sometimes just sitting in Mom's lap, okay? So that may help you out a little bit. I'm just going to measure her head with this little tape, okay?
Okay.
Oh, got a really
So
tiny head.
loud.
Okay. All right, let me just take a look at some other things, okay? We'll take a look at her little palms, okay?
She was born early, so I don't know if that might have something to do with anything.
What we're suspecting, I see this little line right here, this little fold in the crease, and we got a little webbing of the fingers. Let me take a look at her eyes. Yeah, I know it. Yeah. I know, Mama. We're going to work on it, okay? So what we're suspecting is called Cri-du-Chat syndrome, and it's nothing you did, Mama. You were perfectly fine.
It was my husband, wasn't it? I knew it was him. I knew that he was the reason that she acted like this. It was, just like him.
Yes, ma'am. It is something that occurs early on in pregnancy, so it was nothing that you did. It is a little more related to Dad, but that's okay. It just happens sometimes. It is a little rare, but we can do some, treatments and little things to kind of help her develop properly, okay?
So it was him.
Well, we don't know that for sure. The cause of it is unknown, but it can possibly be related more to Dad's. Yes.
So is she gonna die?
No. We're just going to help her kind of develop. We're going to set a little plan to help her develop properly.
Because
okay?
I do love her. I don't want her to die.
I know.
But I want her to shut up.
Yes, I know. I can understand that for sure. We're going to work on that, okay?
Okay.
It may help to get her some food down, for sure.
So, speaking of that, little nurse came in here. She was real sweet.
Yeah.
She came in here and she said something about a cleft palate.
Uh-huh. Yes.
So how am I supposed to feed her if she's got the palate?
Okay, so if we don't get that repaired, there are options to get that repaired. But if not, we would just recommend kind of thickening her milk a little bit. It'll help it go down and stay down.
Okay.
And then you would want to feed her in an upright position. So you don't want to lay her down, okay? So that'll just kind of help it stay up. Yeah, I know it, baby. I know. But yes, Mama, we can do that. And then there's special little nipples to go in the bottle that we can also use as well.
Okay.
Breastfeeding is an option.
No, I don't do that.
That's okay, Mama. We can do, like we said, the special nipples. Just kind of feed her upright, and that should help.
Do you want to breastfeed this? Do you hear her?
Well, I understand that for sure, and it's all in what you want. But we can get her taken care of both ways, and y'all will be good to go. We're going to run some more tests on her, like just some gene testing and stuff, and then we'll be right back, okay?
Do you have to get anything from me?
No, I don't think so. We're just going to check it from her.
I don't do needles.
Okay, I understand that.
Okay.
I understand that. So we'll be right back, okay?
All right. We'll see you then.
We have come to a diagnosis that your baby has. It's called Cri-du-Chat, and it is a chromosomal developmental issue. So we can expect to see a little bit of developmental problems later on. But since you were here a week ago and we suspected this, we went ahead and did the gene testing and, we talked to you about the feedings and stuff like that. Tell us a little bit about how that's gone.
So, she's become a lot more bearable now that I know that she's not just a bad baby and there's something wrong with her. So I've actually started to like her a little more.
Yes, ma'am.
And, the feedings have actually gotten a little bit better. I did what you told me to do. I found a better formula for her. I Googled the cleft palate thing, and I found a formula that was recommended.
Okay, perfect.
And I ordered it off of Amazon, so, I mean, it was here, like, overnight.
Okay.
So I did that, and then we've been setting her up to feed, and, yeah, she's been retaining it. She still does the spit and stuff out sometimes.
Okay,
but
that
it's
can
a
be
lot,
fairly normal.
It's a lot better. I would like to see about scheduling that surgery day.
Yeah,
because
for sure.
she's really messing up all of her outfits. I'm having to do a lot of laundry.
Yes, ma'am. I understand that. We can definitely look at getting that cleft flap, the cleft repaired. Okay. Now, do you have any questions for us, for me, or your nurse, Morgan?
So I know last time we came, y'all said that she had that patent. The hole, the whole thing. So when will we know if it's gone away, and how should we do that?
We can actually take a listen right now.
Okay.
All right.
Come here,
Little Miss Lindsay, I'm gonna take a listen to your heart. Okay, yeah, we don't hear that washing machine sound anymore. So it does normally close within the first few weeks. Yes. Yes.
Girl.
So that is what we look for. So that part's taken care of. So now we just got to worry a little bit about developmental stuff.
Okay.
So I'll let your nurse kind of talk to you about the future stuff for her development, like speech, eating, weight, all that kind of good stuff.
So since you changed her to the thicker formula, she's not spit up as much. She should start to put on a little bit more weight.
Okay,
Might be a little bit less than what other babies usually put on because she did have it for a minute. But I mean, she should start to gain more, and she might start walking and talking a little bit later than other babies. So don't let that alarm you. If she's not walking by 12 months, don't worry about it. It's totally normal. And when she does start to get older, she wants to communicate more. She's gonna be frustrated because she's gonna want to, because she's gonna understand.
Maybe
what
we
you're
could do like sign language.
You could.
I've always wanted to learn that. I've always wanted to learn that.
Because I'm sure she could be able to communicate with her hands a little better than her mouth, because that is going to be an issue for her in the future. But we could do speech therapy to try to encourage that. And
I got a friend that's a speech therapist. Maybe I could get her in with her.
That's perfect. Yeah. But do you have any other questions for us?
I don't think so. Did we?
Hey y'all. So we did learn it's actually called Cri-du-Chat, not Cri-du-Chat or Cri-du-Cat. We just thought it was funny. But I'll let Megan tell you about the patho behind it.
Okay, so it is a congenital disorder that the baby can develop. It's usually developed early on in the embryonic phase, so it's nothing that mama ever does. That way, if mama asks, was it my age or was it something I did when I was pregnant, the answer would be no. The exact cause still is unknown, but it is related to a deletion of a part of the short arm of the chromosome 5, and so it can also be known as the 5p- syndrome or the cat cry syndrome.
Which I obviously cried like a cat, so that's like the main symptom is the cry that sounds like a cat. But there is also a lot of other ones like the fold and the hand and the clubbing, as I was trying to, show and everything. But there's a lot of the eyes. There's a lot of different symptoms that kind of mimic Down syndrome in a way.
Yes.
But really the main manifestation is that cry that sounds just like a cat.
Yep.
And it's really hard on the mamas and the parents of it, because when you're dealing with a baby that's crying like this all the time, it's really hard because your mamas are already tired, they're already stressed, and then you have the baby that's like this, and a lot of times they do have that cleft palate. So on top of that, they're having issues with feeding. We joked about the whole breastfeeding thing, but a lot of times, you do want to recommend to your mothers that if they are breastfeeding, they can continue with that and everything like that. But we also did some research, and while it is unknown, it can be more along the male's genetics, and it can be something going on with the sperm. So that's why we wanted to emphasize the fact that she wanted to make it seem like it was the dad's fault. And it's very common that these babies have a patent ductus arteriosus for longer than 2 or 3 days, like a normal child. And they're going to have microcephaly. Yep. They're going to have, the web finger, stuff like that.
And
so
probably a lot of times are female.
Yes.
Yes, it is more prevalent in females than males.
So there is like a lot of assessment that goes into it, and then we do the genotyping and the karyotyping, and you can make a final diagnosis. But yeah, so hope y'all enjoyed it.
Thanks.